My mom is an awesome woman. I grew up surrounded by her unconditional love in Damascus, the Syrian capital. When you ask her to describe me in one word, she would say, Kattar Ghalabe in Arabic, which in English translates into, for lack of a better word, a serial volunteer who would volunteer the entire family to do things for other. And she was right. I grew up passionate about this idea of an act that I can do that would make people's life a little bit or tiny easier. And things for her get worse as I grew up. But eventually, when I became in my middle school, I decided to be a doctor. For me, being a doctor wouldn't mean just only helping people, but helping them in their darkest times. And I worked so hard to get into medical school, and I managed to get there back in 26, aiming to unleash my commitment to help people once I graduated in 2012. My path took me through different uncertainties and brought me here to the United States back in 2019, where my passion to help patients turned into helping millions at a time. And my commitment to be a cardiac surgeon transferred into being a human rights advocate, defender, and researcher. Uncertainties kept hitting me very hard with my family. And in 2021, we were forced to apply for asylum in the United States. On April, we made that decision, and I worked for 4 months with my legal team to prepare my asylum claim. And here I am, December 1st, 2021, wearing a fancy suit, getting into the Arlington Asylum office, smiling, pretending that I'm relaxed, but barely breathing. Burdened with heavy feelings and painful memories and a 1,000 pages asylum claim, I got into the office during the COVID-19 pandemic. The officer welcomed me, brought me to an office where I sat in front of a screen. He sat in a nearby office, and so we could communicate through that screen. His first open-ended question was, Houssam, tell me about yourself. I said, I'm from Syria, Damascus. I was born in 1988. And I always wanted to be a doctor. In 2006, I left my parents' house for the first time, traveling more than 300 kilometers, now north the country, to enroll in the medical school in Aleppo City. And I was 2 years away from graduating when the Syrian uprising started. People took to the street against the dictator, Bashar al-Assad and his regime, demanding freedom and democracy. The Syrian regime immediately started cracking down on protesters, killing people, detaining them, torturing them, depriving them of their right to access healthcare, and punishing anyone who tries to help them. They even invaded the medical school. As many, I couldn't stand on the side. As much as I tried, I wanted to graduate so I can fulfill my dream, but it just was not possible. And as crazy as it was, I decided to join a clandestine medical team called the Light of Life. That team was a group of medical students, professors from the medical school, and non-medical volunteers. Our role was to travel around demonstrations and help people who get injured by providing them with life-saving medical services and ensure their safe referral to definitive medical care. It never came to my mind how challenging, how dangerous it would be if we get caught. Until after 4 months since establishing the team, when we received a message on social media from the team leader saying, be careful, 3 of the team members were detained. They were heading back from a medical mission when they were stopped by a checkpoint. The checkpoint searched their car and they found medical equipment and realized that they were actually providing healthcare to demonstrators. 2 weeks after that, I remember waking up at 7 a.m. with my phone ringing. I picked up the phone and my friend who was a team member was crying. He said, Houssam, they burnt them. I did not understand what he said until I went to the hospital. Basil Aslan, Mus'ab Barad, and Hazem Batih were detained, tortured to death, shot in the head, and their bodies were burnt. And they were sent to the hospital with their medical IDs. It was a clear message from the government back then that this will be the fate whoever tried to help. I still remember when I got into the hospital and I saw their burned bodies and I smelled their burnt flesh. I asked myself, do I want to carry on with this? After all, and I have to be honest, I consider myself cowardly. I'm not courageous at all. But that did not matter. I just continued to work with my team to carry on their legacy. Circumstances continues to get more challenging. And what started as an injury every few days became multiple injuries every day. What started as the threat of being detained on a checkpoint became a threat of being detained anywhere. But so as our team. The team that started with 10 volunteers became a team of 20. Among those was a girl who I loved at first sight. She was the tiny, bright feeling that filled my soul, but I kept hidden. Days passed by until August 3rd, 2012. It was a Friday afternoon. After a few days spending in a hospital with my friend, we head out in a car, and we were stopped by 5 soldiers. They searched the car. They found a list of medical equipments, our medical IDs, and the tiny stain of blood on my pants. And they made the connection. They said, he is probably treating demonstrators. They immediately put the machine gun on my head and my friend's head and forced me to drive to the detention center. As soon as I got into the detention center, the officer asked us to strip naked so they can do this physical searching, and brought us down 3 floors to separate cells that were overly crowded. Days passed by, and the only thing that I was thinking about was whether I will get out alive or not, and if I will die, how bad it will be until I die. But deep inside, I was proud, knowing that if I die, I will be dying doing the thing that I always wanted to be, which is helping people. The only sound that I was hearing was the screaming of people who were suffering from torture. And the fascinating idea that I had was, if I get out of here alive, I will introduce myself to the parents of that girl and ask her out. On day 16, it was 7 a.m. on a weekend and a public holiday. A guard came to the cell, called my name and my friend's name, asking us out of the cell. He handcuffed us, blindfolded us, and took us to an office. In my head, the dominating thought was, am I going to die? I asked that stupid question to the officer and I said, can I wash my face? Because you woke me up. And he said, shut up. You will wash it when you get out. He handed me a paper with my friend, forcing us to sign a pledge to not treat anyone who is considered as the enemy of the state, who was the label they give to all the demonstrators. I signed that pledge, and to my surprise, it said, now you are free to go. I walked out of the detention center, and for the first time after 16 days, I saw the sun. And the first time I saw the sun, I made that commitment to bring justice to those who suffer from that detention center and to those who will not be able to make it out. From far away, I saw my friend. He was there to pick us up. And the first person I called was my mom. And I remember when I said, hi, Mom. She started crying and said, why did you do this to me? It turned out that my family paid significant amount of money to bribe corrupted officers to get me out so I don't get killed. And it turned out that my mom was brought to hospital multiple times out of the stress and fear, just thinking about what I'm enduring and whether I will get out alive or not. The officer interrupted me, the asylum officer, He said, "Can you give me more details about your detention experience? I know this is not easy, but I want you to give me as much details as possible, with feelings if possible." I said, "From the first moment I get in, I realized how different we were treated. Me and my friend were the doctors. Take off your clothes, doctor." The guard asked the officer, he said, "Can I slap the doctor on the face?" And the officer said, "Of course you can, he's all yours." And I remember when he slapped me on the face for the first time, and that was the first time I get slapped on my face. A spark ignited in my ear, and I was wearing metal braces, and I felt this blood taste in my mouth. When I was brought to the cell, I had to extract the braces from my cheek one by one. Next day, my name was called, and I was brought to the office. The only questions that he was asking me: "Who were you treating, doctor? How did you get your supplies, doctor? Who are other team members?" And I refused to answer him, pretending that I don't know anything and I'm not connected to this type of work. He got angry, he got mad, he threw me on the ground, brought a plastic pipe and started hitting me on my feet, on my legs, on my back, on my thighs, to a level where I could not feel them anymore, and to a level where I would feel pain however I move or lay down on the ground. He then brought me to a room and threatened to electrocute me. He put a probe on my shoulder and pressed the button and started cursing because the machine did not work. In detention, I cried from hunger, I cried from pain, but I also cried seeing people being tortured constantly but unable to receive any care. It was a different type of torture for me as a physician, even if I'm not personally being tortured. The officer interrupted me, the asylum officer interrupted me and said, "Who were you treating, doctor? Did you treat terrorists? Did you treat armed individuals?" And I was ready for this question. I prepared for this question, but I was shocked to the core to hear it being asked. Now, I'm defending myself as a potential terrorist sympathizer, and I'm being asked accordingly. I said, "Look, officer, I'm a physician, I'm a doctor. I don't care what is the affiliation of the people I'm treating. I'm saving lives. I don't care if they are affiliated with a regime that tortured me or with a group that is designated as a terrorist group." I reached a point where I would be in the hospital, hearing an air raid, rush physically to my close friends in the hospital to be as close to them as possible, hoping that if the hospital get destroyed and collapse, I would die with them, so I don't witness them dying and leaving me. I'm a healthcare worker. I treated people, I saved their lives. I'm not a judge. The interview went on for 7 hours. I left the office at 4 p.m., destroyed. At the end of the day, the core of my values were questioned. And I was lingering on that question between me and myself. Did I make the right decisions along my whole life? Did I do anything wrong? I sunk deep into major depression, into triggered ADHD, and I felt afraid of my identity, my Syrian friends, my Syrian family, the work on Syria, and my Syrian community, and my Syrian passport, and everything related to Syria. The only thing that I was trying to push my way through was continuing the meaningful work that I was doing with Physicians for Human Rights, documenting atrocities committed in Syria, and working hard to bring justice to those who endured these atrocities. 3 years passed by, and my asylum claim continued to be lingering and extended security clearance. Until that day, December 8th, at 9 p.m., 2024. Myself, And the girlfriend from Syria, Yasmin, who became my wife, my daughter, who was 8 years old, Sema, who we named after her mom's fake name from Syria, and our 2 years old daughter, Selena, watching the news unfolding. Bashar al-Assad have escaped the country. His army, his security forces, and his regime collapsed. And the country is ours again. I kept looking into the screen and looking into my family again, not believing what is happening. The regime that stole my youth, that stole my future, that stole my dreams, the regime that killed many people is no longer there. And I started thinking about my friends who were not there to witness this day. My mom, who endured a lifetime pain and fear of her son, who she raised to stand up for what is right. And for the first time, I started having hope. For many years, I experienced exile. I struggled with an identity that felt both powerful but fragile. And for the first time, I felt that there is a pathway forward. But this news brought a new uncertainty for us. I remember Sema. She asked me, Dad, are we going back to Syria now that Bashar al-Assad is gone? I did not have an answer. After all, I know that my time in the US equipped me with the knowledge that I need to document the atrocities and the human rights violations and crimes that were committed in Syria. So I stood up. I whispered to myself, saying, whatever happened next, I will continue fighting, not only for Syria's future, but for the dignity and justice that everyone, every person, every physician, every child, every mother deserve. All of a sudden, hope is real again. Thank you.